I am the tofu golem. Please enjoy the video.
You start now. Wash and dry your face so pores are clear and products won't trap bacteria. Next, wrap ice in a thin cloth or use a silicone ice globe. This prevents ice burn and gives even cooling. Hold it lightly, do not press, then glide across one area for 30 to 60 seconds, keeping motion steady. You want a cooling effect, not numbing pain. Once done on one zone, move immediately to the next. This builds circulation while calming inflammation. Once you have started, maintain gentle, continuous motion. Avoid pinning ice to a single spot because that risks frostnip. Make short cycles, 30 to 60 seconds per zone, rest briefly, then repeat up to 3 rounds total if tolerated. While you work, follow lymphatic pathways. Sweep outward and slightly upward toward the temples and jaw to encourage drainage and reduce puffiness. Make sure to breathe and check skin color regularly. If skin turns blotchy, to finish, gently pat your face dry and follow with a lightweight moisturizer or hydrating serum within 2 minutes so active ingredients lock in while pores are calm. If you notice persistent redness, numbness, or stinging, stop and use a warm compress for 10 to 15 minutes to restore normal sensation and avoid further icing today. If you have unusual reactions, long-lasting blanching, or a history of cold sensitivity, consult a clinician before repeating. One key tip: never apply ice directly, always buffer it with cloth.
Thanks for watching. Consider subscribing if we helped you today.